Hi guys, welcome to my channel. Thank you so much for watching. If you're new here, please consider subscribing to my channel. If you're a returning subscriber, thank you so much for coming back. I truly appreciate all the love and support. Thank you so much, guys. My name is Linda, and on this channel I talk a lot about nursing, personal finance, motherhood, faith, and basically life in the UK in general. On today's topic, we're going to be talking about the role of the Advanced Nurse Practitioner or Advanced Clinical Practitioner. We're going to be talking about what they do, entry requirements, their salary, and basically a lot of information about the role. So I hope that this video will be helpful and that this video will inspire you to apply for the role and progress in your career as a nurse. Right, so what is an Advanced Clinical Practitioner? An Advanced Clinical Practitioner is a registered healthcare professional who has gained advanced knowledge and skills to be able to work competently and independently as part of the medical team. So they're referred to as Advanced Clinical Practitioner or Advanced Nurse Practitioner, but they do the exact same role. The only difference is that Advanced Nurse Practitioner have a nursing background, so they would have had experience working as a registered nurse, whereas an Advanced Clinical Practitioner can be from any background. You know, they can be nurses, pharmacists, physiotherapists, occupational therapists, and paramedics as well. But they are all expected to work at an advanced level as part of the medical team. So throughout this video, I'll be referring to them as ACP because Advanced Clinical Practitioner is quite a long word to say. Right, so what is the role of an ACP or an ANP? So basically their role depends on where they work. You can see them working in different areas. They work in primary care, so GP settings or in the community. You can also see them in ED, in neonate, in ICU, in pediatric, acute medicine, surgery. They work in different areas and their role will depend on where they work. So for instance, an ACP in ED will have certain skills that they need to have compared to an ACP in ICU, and that's because of the kind of patients that they see in that setting. But in general, they all need to function at an advanced level and have the experience and the skills to look after patients competently as part of the medical team. So in relation to what they do on a daily basis, they need to be able to function competently according to the 4 pillars of advanced clinical practice, which are clinical practice, leadership and management, education and research. So they work as part of the medical team to complement junior doctors, which is why a lot of times you might see them during doctors' ward round. And the whole idea is that they help the junior doctors and they're able to relieve some of the pressures from the junior doctors. So they are not medical doctors, but they can do some of the duties and some of the jobs that the junior doctors would normally do. So they need to have advanced clinical skills, for instance, skills in history taking, patient assessment, evaluating patient's condition, and they can look after patients with complex needs. So for instance, imagine a patient comes into the hospital with chest pain. As an ACP, you need to be able to take a detailed history from that patient, decide on what clinical assessment you want to do for that patient, decide on what blood tests and what investigations, what scans you want to do for that patient. You need to be able to interpret the result of all these scans and then decide on the treatment for the patient. So as you can see, it's a lot of responsibility. At the end of the day, they have the knowledge and the skills to be able to practice competently. They also need to be able to perform a lot of clinical skills like taking blood, interpreting blood results, taking ECG, interpreting ECGs. They need to be able to order scans. So your CT scans, your X-ray scans, lumbar puncture, catheterization, interpret ABG, prescribe medication for patients. In terms of leadership and management, they need to act as role models for other members of staff. They are involved in clinical governance. They provide clinical leadership. They are involved in teaching and mentoring other people, as well as being dedicated to their own professional learning. They are involved in research and auditing. They are involved in writing policies, making sure that local hospital policy aligns with national guidelines. You can say it's quite a lot of responsibility, and you have to train for years to be qualified as an ACP. But once you get that qualification, the job can be very rewarding. In terms of the salary, a qualified ACP will be paid as a Band 8A, which at the time of filming this video, the salary for a Band 8A is 48,536 to 54,619, and that's excluding all enhancements, so excluding your bank holidays, your weekend, and your night rates. So you can see they are paid quite well, but usually you start off first as a trainee ACP. So you start off as a band 6, and after you've completed certain credits and certain modules and completed certain parts of your portfolio, you progress to a band 7. And then by the time you've completed your full Masters in Advanced Clinical Practice and completed your clinical portfolio, then you become qualified as an ACP, and then you progress to a band 8. So it takes time. It takes between 3 to 5 years to actually qualify as an ACP. One unique thing about this role is that the progression can be quite fast. So imagine starting off as a trainee ACP at a band 6 level, and within 3 years, once you've completed your master's degree and you've completed all your clinical portfolio and qualify, you become a band 8A. So within 3 years, you've gone from a band 6 to a band 8A. However, it is a lot of work, responsibility, a lot of dedication, a lot of assessment and competencies that you need to complete. So what usually happens is you start working as a trainee, you need to complete your Masters in Advanced Clinical Practice, complete your full clinical portfolio, and then you become a band 8A. So the whole idea is that while you're working as a trainee, you'll be studying your modules at university for your Masters in Advanced Clinical Practice, and at the same time working clinically to be able to learn and gain all the skills that you need on the job. And usually they might advertise the role as a full-time role, so 37.5 hours. But what happens is that out of that 37.5 hours, you could be working clinically for like 30 hours. So you could be working 30 hours a week and then going to university for your modules for 7.5 hours a week. So your time at uni is actually counted as part of your working hours, which is quite good because basically you're getting paid to study, guys. So generally, the entry requirements are you need to be employed in your profession. So you need to be employed as a nurse, paramedic, physiotherapist, or pharmacist. You need to have at least 3 to 5 years post-registration clinical experience. You also need to be registered with your governing body. So nurses, for example, need to be registered with the NMC, and evidence of leadership or evidence of mentoring and teaching other people as well can be helpful. In terms of studying for your Masters in Advanced Clinical Practice, so usually you'll be studying part-time, and it should take about 3 to 5 years to complete the full Masters. So that means that you can take a break from your studies as long as you complete all the modules within 5 years to achieve your Masters in Advanced Clinical Practice. You will need a total of 180 credits to achieve your full Masters in Advanced Clinical Practice. The kind of modules you'll be studying would be clinical decision-making module, your non-medical prescribing, and principles of advanced clinical practice. Some of these modules will be 20 credits or 30 credits or 40 credits. You have to make up a total of 180 credits to get your Masters in Advanced Clinical Practice. One good thing about this is that even if you don't complete your full Masters, so even if you only get 60 credits or 120 credits, you can use these certificates to work in other roles like ED Nurse Practitioner or Night Nurse Practitioner. In terms of funding, usually when you're working as a trainee ACP, if you're employed by the trust will fund your studies for you. But some people also have the option to fund the studies themselves. It all depends on what you want and what works best for your situation. If you're thinking of this role, definitely consider it, guys. And also, you could be studying for free and at the same time progressing in your nursing career, which is amazing. Also, there are not many roles in nursing that allows you to progress so quickly. Imagine within 3 years, you've gone from a band 6 to a band 8, right? So that's absolutely exciting. But you have to think about all the hard work, all the portfolio. So you need to be dedicated to your professional growth. Also, you'll be expected to complete your portfolio before you qualify as an ACP. So as part of that portfolio, there are certain clinical skills and certain clinical competencies that you need to be achieving at every step of the way. And then once you've ticked all the right boxes and completed your full portfolio, as well as your master's program, then you can progress to become a qualified ACP. I hope you found this video helpful. I hope that this helps you understand more about the role. If you have any more questions regarding the role of an ACP, how to apply for the role, how to go about your master's program, any question in general regarding progressing in your nursing career, definitely hit me up on Instagram send me a DM. Let me know what you think about this role actually. Do you think it's a lot of work? Do you think it's actually worth it going to university for 3 years again after you finish your nursing degree? And that's the end of this video, guys. Thank you so much for watching. Please subscribe, like, comment, share this video till I come your way again. Thank you so much for watching. Take care. Bye-bye.